Absolutely, thank you. So, Dr. Keith and Dr. Linus and Larry and Onime, one of the things that I hear often about is that the COVID seems to affect people differently, you know, and some people have a really, really bad reaction. And it seems like even in the literature, we're seeing that COVID itself could be like a multi-system or multi-organ, affect various organs, and there are long-term effects on things like lungs and the heart, etc. Why is COVID so different in the way that it presents among the population?
Is that a question for me? I didn't
Yeah,
know
anyone can take it. If you want to start, you can, and others can chime in.
So, I'll start just because I'm tackling this from the bedside experience of what I've had with COVID, with the research and how all the mechanism of action of all the drugs we're studying. And I think, I had opined with my residents when I was working at the first wave that we had in South Florida, that if you were going to erase millions of years of evolution, meaning take us all the way back to before we could walk on this planet with, getting out of water and walking on land, that's exactly what this virus does. So it erases our ability to protect ourselves from clotting. It erases our ability to get oxygen from air and into blood. It damages all the vital organ systems that we require in order to cleanse our blood. And so I think it's a multiple hit phenomenon. And unfortunately, it's highly transmissible. And I think that's the other side to this virus that makes it such a danger. Again, flu is very dangerous. But again, we can mitigate a lot of the concerns that the flu provides simply because it has a time onset and time offset that's reliable and we can predict. Whereas this virus seems to decide when it's going to manifest its symptoms. And before it manifests symptoms, maybe you've had opportunity to meet with many people and spread the virus before you've even known that you were exposed. So it hides. So not only does it hide, but it also unfortunately affects so many body systems at the exact same time, kind of a cascading effect in some patients. But I think in the older population, we saw that it happens all at once in some settings. And then it evades our ability to actually tackle it, or what's called the innate immune system. I think Dr. Linus may be able to speak to that better than I can as an immunologist, but I think unfortunately, it hides really well within our bodies and evades our ability to actually affect its replication. And so I think, unfortunately, this is just a horrible type of virus to catch if you've not had opportunity to be vaccinated. And it's also a horrible virus to catch even if you're healthy and young, in that it can replicate rather quickly and infect a large number of cells before your symptoms start to manifest.
Wow, that's really interesting. So, Dr. Linus, we're going to put you on the spot here, since you're also an immunology fellow. So, in terms of why the vaccine acts so differently, I think I'm slowly echoing, but that's okay. In terms of as to why the vaccine acts so differently in different people, Dr. Keith mentioned something about an immune response, and I know I was reading in the literature that sometimes some people have autoantibodies, and what tends to happen sometimes is that, if you have a predisposition to having autoantibodies and then you get COVID, then COVID is more severe when you do have it. The challenge now is that people that do have autoantibodies don't know that they are predisposed to having autoantibodies, and there's a lot of work right now being done to provide tests or testing for these autoantibodies so that you can kind of stratify the patients and identify maybe which patients might have a more severe case of COVID. But in just your experience or just your thinking and your knowledge, why do you think that the COVID shows up so differently in different people?
Thank you very much, Zezi. And thank you so much, Dr. Keith, for that eloquent issue. Here is the thing about COVID, unfortunately. We react to infection. Our bodies react to infection very differently. The sad thing about COVID is that it's still evolving. We're still getting to understand it. More and more work is being done on COVID. In fact, the scientific community has done tremendous job in trying to wrap up researches and publication on COVID. Now, on the issue of why it shows up differently in different people, I think it's just personal idiosyncrasies. Decide what the expectation is varied. The problem that most people may have is that they do not know symptoms that they would have that should get them to the doors of their doctors. For instance, loss of smell is one of the common symptoms that people from Nigeria have reported that they have when they have COVID. And when people have loss of smell, if you do not know that you have loss of smell is a symptom of COVID, you may not get in to see your doctor until it progresses to having fevers and chills. Okay? Again, it depends on education. How educated is the community? How educated are people? How aware are people of the various symptoms of COVID? And that's where the interplay is. It's not like at the end of the day, if you let the pathology to run its course, like Dr. Keith has elucidated, it affects our lungs, stops us from breathing, and affects various organs of the body. But when it starts, if you're able to get in before it gets to your lungs, then it is stopped. But if you don't know that diarrhea is a symptom of COVID, for instance, if you have diarrhea, you may not think you have COVID. You understand what I'm saying? Until you begin to have fever or until you begin to have chills. Okay? So our body reacts to COVID. If you want to talk about the immunologic basis of our reaction to COVID, the COVID virus is a foreign virus to us. So when it comes in, your body senses something foreign has entered its domain and immediately triggers antibody production against that COVID virus. Okay? The more antibody your body produces to fight this COVID virus, the more symptoms in other parts of your body you would feel. But the goal here is to get people to understand and expect that symptom they feel, especially back home, that they think is malaria, is probably not malaria. If you are weak and you're having fever, the default, unfortunately, both for the general populace and for some of my colleagues in Nigeria, is that when you come in fever chills, the first reflex action is malaria. Okay? There is lack of widespread testing in Nigeria. And so out here, people are more educated to know what to expect. So that whenever they have any symptoms, the doctors here are already in tune with symptoms to expect, so we do more tests. Okay? So it is not as much as people reacting to COVID differently. It is the point you catch the person on the disease progress.
On the spectrum.
Okay. Uzeze, I'm going to just make a quick comment.
Sure.
I hope I'm not echoing too much. On published literature, there are only two major issues that have been brought in. One of the facts is the fact that people with low vitamin D levels are more likely to have a severe form of COVID, and also people who have blood types A or AB. So in published literature, those are the only real two factors why people actually respond differently. And of course, that you cannot change. So most of the time, the person may have had a low vitamin D level already, and person already has an O type or an AB type, and that you cannot change. But in the literature published, people with A or AB are more likely to do worse with COVID, and people who have low vitamin D level have worse outcomes. So that's what is on published literature.
That is so interesting, Dr. Larry. I'm not sure why we're having so much echo, but that is very, very interesting that you actually state that, because sometimes I use myself as a guinea pig, and I have to say that I take a 50,000 IU units of vitamin D. So that's for different reasons. But what that is a long-acting vitamin D, and it stays in your system like for a whole week. So I have to take it once a week. I noticed that when I remember to take it, frankly, I feel just a lot better. So, I mean, I've been hearing a lot about vitamin D, and I didn't even understand or realize the implications with COVID. So I hope that maybe towards the end, we may talk about some natural or some common sense things that we can do to help us. So that's very interesting to hear that. And also talking about the different blood types. So I'm just wondering is, Dr. Linus made a good point, which is sometimes people have different symptoms and they don't really know what, they think it's something else. But I just wonder, and you guys can tell us as medics, if maybe going down the line that as we learn more about COVID, we might need to test for certain things, for example, maybe vitamin D levels, the blood type, do they have autoantibodies to help us be able to manage COVID better? What are some of your thoughts on how, we could probably manage COVID better, knowing that some people will have a stronger reaction or stronger effect from it? And you can answer, Dr. Lanre or Onyeme. I think he's on mute, Ken.
Yeah, I would defer to Lanre. He's seeing way more COVID patients.
Okay. Lanre, you're on mute.
I didn't hear it.
Yeah, go ahead, Lanre.
I didn't hear the question well.
I said, knowing that there are various things that we can do, how do you think, or what would you recommend as management? Because you've talked about low vitamin D levels, you've talked about the different blood types, and we've also talked in the literature about the presence of autoantibodies. How would you recommend for management of people so that, they don't fall into a situation where they are severe because of these things that they have and they don't know that they have? Because we're always very shocked when we hear this young person, just like you told me this morning when you were driving up to go see a 27-year-old that had COVID, and then you see a 60-year-old that does well, or somebody that just gets COVID and all of a sudden they are gone. How can we, or how can the medical community make sure that we are checking for some of these things upfront as part of diagnosis?
Some factors we cannot modify in life, Uzizi. So some of the things up until COVID happened, I remember that as a doctor, I get a medical exam every year. And I think about 4 years ago, that was the first time somebody told me I had low vitamin D level. And I scoffed at my primary care doctor, who was my colleague, and said, "You guys come up every day with these new problems that we have to fix." And I laughed, but I said, "Okay, since you are telling me I have to fix it, me as a Nigerian who should go out, I should have a good vitamin D level." And I took the medicine, and of course, after that, for the next 4 years, I've been okay. And it's interesting that at the time when he recommended it, it wasn't as if everybody knew that these findings will occur in COVID. So many of these things just says that we should do regular medical checkups just for the sake of doing it. That's really what we can say. There's really nothing else that we can prepare for. Nobody prepared really for the epidemic, but there it is, we have it. But because we know beforehand certain things, even before any illness comes, then we have a chance to be protective for it. And that is the only recommendation I'll make. I won't want people to start going out to drink, tons of vitamin D or tons of vitamin C, because there's really no evidence for it, at least at this time.
Right. This is Keith. I think from a pulmonary critical care perspective, and also knowing what we know about the virus, I think everything that the Dr. Larry has just stated is true, which is the reason diabetes, hypertension, men, I think that was a question that was asked, are so at greater risk of having concern is because we live in a Western diet. We live where, unfortunately, atherosclerosis, which is the common denominator between hypertension, diabetes, men, and atherosclerosis, is why this virus behaves so poorly in so many highly at-risk patient populations. And then add being of African descent. So for me, being African American, again, just raises the risk that, Black folk will have a higher risk of having a bad or more severe illness. And so we can't erase all the decades of bad diet, all the decades of not taking our medications prior to COVID, increasing the risks of having atherosclerosis, a hardening of our arteries, as an increased risk factor for having the severe form of COVID. And I think the one thing that we're recognizing with COVID specifically is that it's very much a macrophage-driven phenomenon. And so chronic inflammation. So again, not to pick on folks over the age of 65, but they have a good degree of chronic inflammation as well, whether they have heart disease or not. And so again, this virus has picked a point in time where whether we were healthy, treating our blood pressures appropriately, treating our diabetes appropriately, managing our kidney concerns appropriately, treating our sleep apnea well, all the risk factors you can point to that leads towards chronic inflammation, we'd either had taken care of before this virus or we didn't. And unfortunately, it caught us in time where a large number of people allowed their medical conditions not to be well managed, and unfortunately increased the risks that we would see severe COVID in the population. I think the other part of your question, maybe that hadn't come out, which I think is true, which is it's not just that you get the virus, it's about how much virus you get. Mm. All right, so viral load has everything to do with how significantly ill patients become with COVID. And I think that's why the social distancing, wearing masks, washing our hands, all those things did well in the summertime in decreasing the number of, at least the onset of the rapid peak that we see currently happening here in the winter in the United States. So once you can't decrease the amount of virus you're exposed to, and you get exposed multiple times to a high viral load, that viral load tips at some point to a point where the chronic inflammation that we have leads towards more severe disease. And I think that's why in the summertime, especially, the peak that we saw was not as high, was because we could decrease the amount of virus that people were inhaling and exposing themselves to. So that's why being outside, being away from other folks, and decreasing the amount of virus that we see from a research standpoint has affected how well some of the drugs that we're studying will fare. But I won't go into detail in that regard, because I think I don't want to bore about what we're studying, but I think the idea is that we're very much working in the realm of reactive oxygen species, how well we can decrease what chronic inflammation does in generating more inflammation, which can propagate, unfortunately, the cytokines that leads towards more severe disease.
Absolutely. Thank you, Dr. Keith. Another question we get is, how can we be sure that these vaccines are safe? I know Dr. Nime wanted to answer that or speak to that. How can we be sure that these vaccines are safe? I mean, we've had, we use Operation Warp Speed here in the US, and we've essentially got these vaccines in a couple of months that usually take time. So how is the public to feel reassured that these vaccines are safe and that they can take them?
Well, thanks for that question. The first thing to remember is that vaccines have been around for a while. And vaccines actually changed the world. Vaccines and antimicrobials changed the world in the last 150 years. Now, in terms of specifics of vaccine development, there are various stages every vaccine has to go through, like in drug development, even more so with vaccine development. They have to do the preclinical stages. They have to then proceed, if those are successful, into the clinical stages, which occurs in phases. Now, coronavirus itself is not new. Coronavirus in humans was discovered in about 1960s, various strains of coronaviruses. About 10 years ago, there were two populations that were hit with a different form of coronavirus that caused the MERS, I believe, the Middle Eastern Respiratory Syndrome, and the SARS in Asia, the Severe Acute Respiratory Syndrome. So we've already had information that built up over the years. I think it's for the SARS, there were already phase 1 studies to develop a vaccine. That didn't move forward to phase 2 because it did not end up being as much of a problem as it was. So we already had some preclinical stages data from previous coronavirus infections. Plus mRNA, which is the new technology being used now, has been around for a long time, and it has been in the research phases of developing vaccines with it. It turns out that if you know what the genetic code of a particular virus is, or a particular protein, you can make an mRNA for that protein itself to be produced. Remember that what viruses do when they get into the body is that they hijack the body's cells to be able to replicate themselves. So they are introducing their RNA or DNA into regular human cells and using that process to build themselves multiple times. So we already know that. It was just borrowing from what we already know from science. So as to why or how this happened so fast, there was already a lot of data and a lot of research that had been done, and all we needed to was to adopt this on that body of science that we already knew. Besides, every vaccine goes through the phase 1, phase 2, that has been done for these vaccines, and of course, the phase 3 trials. Phase 1 trials usually is you're trying to develop what is the immunogenicity, how much immune system is being, how much immune response is being generated, and what early information about dosing. In phase 2, you focus on safety and dosing. In phase 1, typically is 100 folks, less than 100 people. Phase 2, for vaccines, you're talking about a few thousand people. So that was done, or that has already been done. And in phase 3, you're now talking about tens of thousands of people. I think for the coronavirus vaccines, what has made things so fast is the intersection of science, industry, funding. Everything just seemed to line up. Because this has been so huge a problem, people have thrown a lot of resources at it, both from the private and the government sectors. And the end result of that is that we have developed vaccines in record time. That has in no way compromised the normal steps that we take for for making vaccines. Recall that the new methods we are using now, the mRNA deal, is not, you've cut out a lot of steps. You're not worried about isolating the virus itself. You're not trying to kill the virus or inactivate it. You're not trying to culture the virus. You just need the genetic code. Once you have the genetic code, you can instruct cells in the body. Typically, I think the macrophages to make the particular protein you are interested in, which ironically is what viruses normally do. They use your cells to make copies of themselves.
Well, thank you for that.
I was going to say, I was going to add that the mRNA vaccines that are available, the platforms were developed over a decade ago. So it's not new technology by any means, like the doctors just relayed. In fact, and I wish they hadn't have used warp speed, because it gave the impression that none of this existed before.
Yeah.
And I think that confusion led towards why there's so much consternation and concern about the safety, because they make it sound like, a year ago, none of this technology existed. But as the doctors just relayed, we've been using this technology for over a decade. So it's not new for us. And I think the one part that is missed is that's wonderful about this technology is that the mRNA that Moderna is producing in their vaccine, it took them 2 days to manufacture, okay, because the technology already existed. And so that means that going forward, if there are significant changes to the virus, it won't take us months like we would say the flu vaccine. It may take us only a couple of days to change what goes into the vaccine. Mm-hmm. And so that again keeps us ahead of the curve in regards to making sure we can reach herd immunity faster. And I think that's the upside of warp speed, if we will. So I just wanted to add that, which is that this technology is not new. It's quite, it's about as old as my kids. And so for me, that means, it's long enough for us to be well aware of what it will do